hard to fight as we age. Our skin sags and droops over time, especially on our face and neck. And many of us would love to do something about it. Dr. Christopher Hamwi is a board-certified plastic surgeon with Florida Plastic Surgery and Med Spa. And he's joined by a familiar face, our friend Coral Pleas. She's the owner of Cutting Loose Salons. And Coral is kind enough to share her face story with us.
Ooh,
you
look good.
See both of you.
Well, thank you.
All right, Dr. Hamwi, let's start with you. What happens within us as we age that causes this inevitable sag?
Sure. Well, that's a great question, and it's a pretty deep one. But superficially, what we see is that as people age or as they lose weight, there's a deflation effect that can happen in the face. The tissue loosens, and in the mid-face, stuff that used to sit up on their cheekbones may come down a little bit. You'll get some nasolabial folds. Maybe the tissue along their jawline loosens, and so people get jowling. And in the neck, the tissue can loosen in a way that things come away, and you lose that nice angle where your jawline comes back and your neck comes up, and it looks really good.
Okay, my favorite part about Coral's story is that I see you all the time.
Yeah.
I barely even knew she had a procedure because there was no massive downtime, weeks and months away. Tell us what brought you to Dr. Hamwi and what you wanted to improve.
I know, because remember, we actually had our Christmas party, and it was only like a week after my surgery, and I think that's what I enjoyed most. It was never painful, but just the swelling and everything to go down. But I still feel like I look like myself, and I think that was the message I wanted to, you know, say is like not to be ashamed or embarrassed by doing it. It's really, you know, just like Dr. Hamwi said, it's self-care.
So what did you do with Coral? Because I know it wasn't a full facelift.
Sure.
But you did a little nips and tucks, and she looks stunning.
Oh, she does. I have a chin.
You do. You look great. I love it. I love it. And so, you know, I think the important part of a consultation is to understand the patient and what brings them in. Because there are a lot of things that we can do, but it's really about figuring out what the patient is trying to achieve and then adjusting the plan to help them reach their goals. And, you know, when Coral's talking about doing this and it being self-care, I think that that's a really important component of this, too. I think that sometimes as people age, there's this sort of misalignment of the way that they feel on the inside and the way they look on the outside. And this is really about sort of like making people look as good as they feel is kind of the saying, and it's about confidence. And thank you for coming on the show, because I think sometimes you know, people aren't totally transparent about their procedure, but for you this was about confidence and self-care, maybe in the same vein as fitness and skincare.
And that's what happened last year. We were on that journey, and I lost 25 pounds, and it literally all went out of my face.
Which is a good thing.
Yes.
Because there's things you can do. And I think the other great takeaway is not to be scared about it, because you don't have to do massive procedures and reconstructs to have people look the way they want to.
To get great results. Yep, absolutely. And so, yeah, there's a recovery associated with it, but this isn't incapacitating, right?
Yes. Oh, no. I was out in a week, you know, out and about. And I was telling him, it's like I still feel like I look like myself. Most everybody goes, oh, I like your hair. And I'm like, it's not my hair.
Well, they say that to you because you're a hairdresser, obviously. But it's nice that you pass the credit to someone else.
And like hairdressers, I think you need to choose the right doctor and the right hairdresser, because that makes all the difference. Yeah, I've had a facelift, so I know what I'm talking about.
There you go.
Get the right doctor.
I did want to share that, too, because I had been to other consultations and chickened out. And it was because it was always my neck. I have my father's chin chest. And, but then they wanted to do all this other stuff, and it freaked me out. And I loved our consultation. He's like, yeah, you just need a little. I was like, yes, just like that.
And that proves that everybody can do something different. It's not one size fits all, because let's be honest, we have all seen plastic surgery gone awry.
Yes.
Sure.
You know, walking around and think, whoo, she doesn't look like she used to look, or she doesn't even look like who knows what. So, and nobody wants that. Well, most of us don't want that.
Yes.
So, you know, I think it's important that we can be open and know that, you know, yes, you did have a procedure, but that you still look exactly like you.
Yeah.
That's right. I think that when you know, plastic surgery isn't about hiding. I mean, it's really about confidence. Confidence isn't something that should hide. And when you remove the stigma, what you're left with is empowerment. And so I think for a lot of people, that's why they pursue this.
Yeah.
So.
And so as a physician, when someone comes to you for a consultation, how do you get through the stigma and assure people that I'm not going to remake your whole look unless you want me to?
Right. Well, that's where understanding the patient and understanding their goals is super important. And then I think techniques have changed also in a way that it looks very natural. We're doing things slightly different now than maybe the old techniques. And so, like you say, people will say, boy, you look really good, but I can't quite put my finger on it.
You look
Exactly,
refreshed.
yeah.
Oh, well, that's wonderful. Carl, congratulations. Thank you for
Thanks.
being open.
Yes.
I know it's something you've wanted
And what
to
a
do.
wonderful experience. I love him and his wife and the office. And
Well, it's good that it's a positive experience. It's always good to take the stigma away from something so many people do wonder about. It's not just facelifts at Florida Plastic Surgery and Med Spa. They are actually having a seminar about tummy tucks coming up in February. You can follow them live on Instagram for that, or you can also join in person. For more information about any of your plastic surgery questions, go to floridaplasticsurgery.com.